I'd like to talk to you about creating a homemade fenestrated multi-hole catheter for use in veterinary medicine. My name is Dr. Stephen Bailey. I'm a feline medicine consultant and owner of exclusively Ecats Veterinary Hospital in Waterford, Michigan. A fenestrated catheter is ideally suited for paracentesis of many organ cavities in small animal practice. The fashioning of a homemade catheter is something that is used often in emergency and critical care techniques. The cost to create one of these catheters is simply the cost of the IV catheter itself, 60 seconds of time, and a scalpel blade. You can use a variety of lengths of catheters, larger and longer ones for use in dogs and other animals. In feline practice, we primarily limit ourselves to using 18 and 20 gauge catheters, 1 to 2 inches in length. Some people prefer to use a number 15 blade scalpel, and others feel more comfortable using the curved side of a number 12 blade scalpel. In practice, you're going to use a septic technique. I'd like to make 4 side holes at 90-degree angles from one another. When I cut, I like to cut point to sharp edge, both facing towards me. It's a flick of the wrist. I'd like to make a 3 millimeter cut. I'd like to make them at 90 degrees from one another. And I'd like to make 4 of them. The end result is a catheter with 4 side holes and a hole on the end. So in practice, you might want to make more than one of these, or you might not be happy with how your first one went. I will put my scalpel blade back in the tinfoil holder to keep it aseptic. Your assistant could hand you your sterile catheter. Conceivably, you can work even without gloves because you're not going to be handling the working end of the scalpel blade. You're not going to be handling the working end of the catheter, so you could even conceivably use aseptic technique without wearing gloves. So we're going to go ahead and make on a little bit longer catheter. 1 side hole, 2 side hole, 3 side hole, 4 side hole, and that's how easy and quick it is.